"35,000 people a year have heart surgery in the UK. Most people make a straightforward recovery and go home quickly, but about 1 in 4 people stay in the intensive care unit, the ICU, longer than usual. The major cause of this is inflammation, similar to the inflammation that occurs after a sprained ankle, but instead of occurring in a small area, as in a sprained ankle, it occurs across the whole body."
So this project really is about understanding how the hypothalamic pituitary adrenal axis functions after major cardiac surgery, and how inflammatory mediators and the chemicals that are produced by the surgery affect production of the body's natural anti-inflammatory steroid cortisol.
Uncontrolled inflammation can lead to failure of the body's organs. One of the things that protects the body from excessive inflammation is the steroid hormone cortisol. This usually increases after heart surgery. We think some people don't produce enough cortisol to counteract this inflammation. But because we do not know how cortisol is controlled, we cannot produce tests to work out who may need extra cortisol or design the best treatments to reduce inflammation. Because cortisol is produced in pulses, understanding how the inflammatory signals change the amount of cortisol produced is difficult. We want to use maths to understand the interactions between the chemical signals that cause the inflammation and cortisol.
Mathematical modeling is the attempt to simulate real-world behaviors and events using a computer, and then to make predictions about the future or to understand the mechanisms that underlie those phenomena.
So the value of mathematicians is they come to it completely fresh and they have no preconceived ideas about anything. So they just answer the questions and look for solutions purely based on data, not based on any preconceptions that I might have as a doctor from having looked after patients. Mathematics and computer science are really valuable in healthcare because they allow us to build models that we can try out ideas in the computer before we take them and try them out in patients.
Using data from heart surgery patients, we can use the model to predict how the inflammatory responses might change with different inflammatory signals, and look at the differences between people who recover quickly after heart surgery and those who do not.
In this case, we need mathematics because we have these data sets, but we don't have enough understanding of what is causing these data to occur the way they do. The techniques I'm using are very different from statistical modeling because really what we're doing is we're telling the computer specifically what we understand about the mechanisms in the body and then evolving them in time using the computer. So it's more about giving it the mechanisms rather than giving it the data and trying to extract something from the data.
In the future, these models would be useful to tell us whether giving steroids at different times and doses could reduce recovery times from surgery. They will also help personalize dosing regimes to individual patients.
So what we really want this to lead to is a better understanding of how the adrenal gland functions after surgery and how that controls the steroid production after surgery in major critical illness, because there's a general perception that some people don't produce enough steroid after surgery and in critical illness, and by understanding that we will be able to diagnose who those people are better and give them more rational treatments.
To broaden the reach of our research, we worked with artist Pietro Bardini, who adapted this model to create an ever-evolving sound installation. This computer-generated composition builds on the relationship between inflammatory signals and hormones to control the movements of its sounds.
In the next 5 to 10 years, hopefully we will have sort of a fully worked out model that we can begin to work on an individual patient level.